We're joined now by Dr. Cameron Webb. He's the commissioner of the Virginia Department of Health. Doctor, thank you so much for being with us as we've learned that a passenger from that stricken ship is now back in Virginia. Obviously, people from all over were on this ship and are on this ship. Is that passenger exhibiting any symptoms, and how are they being monitored?
Yeah, well, thanks for having me. We certainly have been tracking this very closely. That passenger who arrived back in Virginia has been in touch with our local health district, has been receiving guidance from the health district in terms of what symptoms to look for and what those contingencies are. But that individual this time is not showing any symptoms, and we're continuing to stay in pretty constant contact with them.
So they're isolating in their home?
They're not the recommendations that we got from CDC at this time, while they're not having any symptoms, isn't to necessarily isolate in their home, but the nature of the communication with our health district is really making sure that we're keeping track of any symptoms that they can have. And of course, with hantavirus, with this Andes virus specifically, those symptoms can be fairly nonspecific. It's fever, it's fatigue, it's muscle aches. And so with all of that, we're making sure we're tracking all those potential symptoms to stay in front of this. And at any point that there are symptoms that are identified, that's when we would make sure that they are isolating for sure.
Certainly. Okay, so they're not isolating and they are not symptomatic, but as we also understand, there is a 2 to 6 week window potentially for displaying symptoms here. It is unfortunately rather long. In the course of that window, how are state officials, health officials in touch with them? Is this a daily thing? What's the protocol?
Yeah, the protocol that we have in place, of course, under guidance from our colleagues at the CDC, we're in touch with them every day. So we're reaching out to them, talking with them on the phone daily. We can communicate with them via text. And this particular individual has been really eager to stay in communication with us, and so we're grateful for that. I think from there, the recommendation is to check their temperature twice a day. And so that way we're monitoring those symptoms for fever, and then just going through that checklist of potential symptoms that we tend to see with Andes virus so that we can stay in front of it.
And then do they keep track of who they may have come into contact with in the meantime in case they do become symptomatic? What's the guidance there?
Yeah, so some of this goes back to how this virus behaves, and so typically they're the most infectious right at the onset of symptoms. And so the way that we're approaching it again with our daily communication with them is at the point that they were to develop any of the enumerated symptoms with this hantavirus, that's when we're going to say, hey, let's make sure you're not having contact with other folks, isolate, and actually connecting them with healthcare providers pretty immediately. So we've already set the stage in that region, make sure that the health providers know that they're able to come to a facility that has that higher level of care for some of the worst outcomes we can see from hantavirus. But no, for that individual specifically, the goal would be at the immediate onset of symptoms. That's when we would have them isolated.
Are you expecting any other passengers from the ship to come to Virginia?
Our understanding from the passengers on the ship is that there's a small number of Virginians who are still on the ship. And so, we're working with authorities and other officials to coordinate their return. And so, when they are repatriated, of course, we're going to make proper precautions, put those in place, make sure that we're communicating with the local health district, with the healthcare providers nearby. And so we're doing that work long in advance of when they return to the United States to make sure the infrastructure is in place to take care of.
You were a senior advisor in the White House Office of COVID-19 response during the Biden administration. And one of the lessons from COVID that still kind of has ripple effects in public health today is that so much of this is about effective messaging and trust in officials. How do health authorities like yourself effectively communicate that the risk is generally very low, but also prevent panic? Because there will be people concerned, obviously, that this is someone who's just kind of awaiting to see if they might be symptomatic. How do you do that while also being transparent about what's known about exposure and suspected cases?
Sure. I think the key here is communicating early and often, getting the message out to the general public, but also specifically communicating with the affected individuals, with the healthcare and public health infrastructure around them. I think for the public's purposes, this is a virus that most folks aren't familiar with. So doing a little bit of that educating on the front end through conversations like the one you and I are having right now to make sure that folks understand when the infectious period is believed to begin, and for those individuals who are coming back from the MV I think the key for us is making sure we're in touch early and often, right? As we're monitoring really closely, that way we're able to really wrap the public health apparatus around them and do the work that we know how to do and that we're trained to do, and that's to keep the public safe.
The U.S. formally withdrew from the WHO earlier this year. How much does that matter right now? And do you believe that's having any effect on the overall response and the U.S. government response to this?
Yeah, I can't really speak to the U.S. government response, from that perspective. What I can say from the ground and from here in the Commonwealth of Virginia is that we've had great coordination with our partners in CDC, and it seems that they've been in really good contact with WHO, and that work has happened pretty seamlessly. And as was mentioned earlier, this is a pretty complex, large-scale endeavor, and so it seems like all parties are operating at the top of their game, sharing information readily, taking it seriously so that we can all be appropriately prepared. So, from our standpoint, it feels like we've been able to have a thoughtful and strong response alongside CDC, and we're continuing to stay in close touch to make sure that remains the case.
And just real quickly before I let you go, you said a small number of Virginians are still on this ship. Do you know exactly how many?
Yeah, like we said, our estimate is it's a small number, so don't want to say specifically, but we're saying less than 5 is what we've identified, and so that's what we're preparing for.
All right, Dr. Cameron Webb, we appreciate you being with us. Thank you so much.
Thanks for having me.
Still to come.